In regards to minimally invasive approaches to mitral valve replacement surgery, there are a handful of things you can do with TEE to help the surgeon both with cannulation and cardioplegia strategies. The first of these is the femoral venous cannula. You're going to obtain a mid-esophageal bicaval view. As that wire is placed in the femoral vein, you will see the guide wire coming up into the right atrium from the IVC and engaging in the SVC. You want to make sure it's not going across the inner atrial septum or into the right atrial appendage. Also, when that femoral venous cannula is passed up over that wire, make sure it enters the right atrium and engages the SVC and does not enter any of those structures we just mentioned. Some of the things that can happen here is where that wire is either not in the venous system or it gets stuck in the IVC or going down a hepatic vein or other vein. When helping guide the femoral arterial cannula placement, it's very common that you will not be able to see that femoral arterial cannula at all as it's too low in the patient's body, but you will be able to see that femoral arterial wire placed in that femoral artery and up into the descending aorta to confirm that the placement is arterial. In regards to cardioplegia strategies, you can help by guiding that retrograde cardioplegia catheter. You'll want to visualize the coronary sinus and see that inflated coronary sinus catheter balloon in the coronary sinus. And when you're on cardiopulmonary bypass and you're administering cardioplegia with that balloon up, confirm the absence of flow around that balloon and see it only being administered downstream from that catheter tip. You can look in two different main views for this, either the mid-esophageal modified bicaval view or the deep esophageal four-chamber view to see the coronary sinus well. Also, there's other strategies out there. We're not going to go over them, but certain things like endo balloons, floating your own coronary sinus catheter via the IJ, or other strategies are other things that can occur in these minimally invasive mitral valve replacement surgeries.